The season of sickness across the Northland is raging on. People of all ages have been hospitalized for things like COVID, RSV, and now, increasingly, the flu. Northern News Now's Isabella Zadra spoke with medical officials about what they're seeing in emergency rooms in Minnesota and Wisconsin.
As you can see from this graph spanning over 5 years, this red line is us entering into 2025. And the number of those being hospitalized with influenza here in Minnesota is peaking dramatically higher and earlier compared to years since 2019. According to the Division of Infectious Disease, Minnesota has seen more than 1,700 flu hospitalizations so far this season. Chris Delp is an attending emergency physician at Aspira St. Luke's.
This kind of volume is surprising. We were prepared for a normal flu season, but this is very abnormal compared to the last couple of years.
Delp said there are a few reasons why these numbers have spiked.
Had this a big cold snap, then it drives everybody inside, which makes it very easy to transmit the virus.
There's also a decrease in people getting vaccinated. Wisconsin respiratory etymologist Tom Hopt says his state is seeing a similar decrease in vaccinations.
And this is about 5 years in a row, but actually pre-pandemic was the last time we had our highest numbers, and that was, I believe, 40%.
In the first week of 2025 alone, more than 600 flu hospitalizations are on the books in Wisconsin. Delp recommends keeping hands washed and masking up if you're around large crowds, and to get your flu shot.
Influenza in a normal season will kill about 30 to 40,000 people in the United States. With a decrease in vaccination rates, we're expecting that to increase as well.
In Duluth, Isabella Zadra, Northern News Now.
Although hospitals are seeing mostly influenza cases right now, Delp mentioned they have also seen increases in COVID and RSV hospitalizations.